Hayden Institute of Education. It's the Diploma of Mental Health. I'm Dwayne, and tonight and next week we're doing this module here on screen: provide early intervention, health prevention and promotion programs. So it's CHCMHS009. It's the first session of two. Over the next 6 weeks, maybe a couple of months, all of the modules are 2 weekly. Like sometimes it drops down to through your course. Sometimes it might be one module a week, and you've got a load of assessments to do for that one module. And then other weeks, you'll have 3 or 4 weeks on one module, which is really nice because there's not as many assessments piled on. But as I said, for the next few weeks, probably late June, all the modules are 2 weeks each. And it means that they're not really long, but they're not really short. There's some consistency there. So it's 2 weeks and then a new module, 2 weeks. It makes it fairly consistent to get into a routine with, which is helpful. So tonight we're looking at this. First of all, we'll do the acknowledgement of country. In the spirit of reconciliation, Hayden Institute of Education acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual and cultural costs of that sharing, and hope that we will move forward together in harmony and in the spirit of healing. We pay our respect to all First Nation people and acknowledge elders past, present and emerging. Just to start off, this is the housekeeping, the expectations of your expectations of us and us of you every week. It's a camera college, so we're trying to make it as close as we can to being in the same physical room. By using cameras, it means that we can see everybody, we can interact with people, and we can try and understand the way people are communicating a lot easier, hopefully. So if we're studying here with cameras and microphones off as well, because can cause a lot of feedback and interference. At times, it can be difficult with like animals or children in the background or microphone going through the speakers, or the speakers going through the microphone and interference. It's difficult. Break times with a few hours of study, you definitely need a break. So we do 7 o'clock and 8 o'clock each for 10 minutes each, around that. And then with the class participation, there's just to keep it structured so that we know where everything is. There's a reactions icon underneath your video. That's if you click on that, it shows you how to put a hand up, just so that we can, rather than everybody talking over everybody. Once you've clicked on that, it shows that one person's got the hand up already. It works pretty well. So with that, we're looking at respectful relationships. Be mindful and kind with your words and respect the opinion of others. We're all learners and in this together. It's true. Working together, learning. No smoking, vaping, or drinking alcohol on camera. Excuse me. Obviously, it's just like a TAFE class or a work meeting, staff meeting. We wouldn't be doing it there, so we don't want to do it here. Also, we could trigger somebody if somebody comes and sees people doing something that they are trying to give up, and they see somebody doing that here. It's not really going to help them. And with triggers, while talking about triggers, some of the content in the sessions can be confronting enough and overwhelming or triggering enough. We don't want to add anything extra, any more problems there. So finally, be kind to yourself. Yes, we're looking at other respectful relationships with other people, but we're also wanting you to be kind to yourself with a few hours of study, a few hours of work, a few hours of family time, a few hours of everything that you need to do in the week. It all builds up. And if all you've got is hours and hours of emptying yourself for the people, you're going to run out of steam. And that's kind of one of the reasons why the community services industry has a job shelf life, where people are going above and beyond in everything they do and burn out and decide after a couple of years that maybe working for other people and with other people is not for them and go and get a job in a quiet place. Well, if we learn how to keep pace from the beginning, it means that our physical, mental, emotional health will sustain us all the way through rather than being a big flash and burning out in a couple of years. Ideally, uh, ideally, not necessarily always working. So, as I said, it's the first session tonight. So, tonight we are looking at mental health programs focusing on mental health and well-being. Well-being is more than just being healthy. When you go to the doctor and they say, "Oh, yeah, you're healthy," um, they usually mean physically healthy because that's what everybody thinks about. But when we're talking about well-being, that's more than just being physically healthy, and that's what we've got to focus on. It's better to be it's better to have an overall good good level of well-being than it is just to be physically really, really healthy. So we've got to look at all that. People with mental illness in a range of community services and work contexts. So this is the mental health diploma, but that doesn't mean that you're pigeonholing yourself or you're categorizing yourself into a specific field of work. Like you could be mental health worker in youth work. You could be a mental health worker in the AOD sector. You could be a mental health worker in aged care or in NDIS or so many different areas of the community services. You could even be a mental health worker, take your diploma, be a mental health worker in industry, in some like HR department and in banking field, in finance. But it's the diploma in mental health that's taken you in that route, which is great. Early intervention, health prevention, and promotion programs. I'm not quite sure whether they've got that the right way around. We're not preventing health. Negative mental health prevention, I guess, would work, and health promotion. I think that's what it's trying to say. Anyway, so the issues that we've got, whether it's communities, groups, or individuals, like your client that you have in the future, you could be backed up with clients clients, 5 or 6 clients a day of individual people, but then you could also have specific families, and you could be working with groups of clients, one after another, but then you could equally be working with communities. And the difference so you're doing diploma, other people are doing a certificate for in mental health, and the way the government wants to structure it is the certificate for in whatever you're doing, you're meant to be a team member. So that might be a cert for in finance, that might be a cert for in construction, that might be a cert for in business or whatever. You're going to be a team member with that qualification. You're not going to get as much of a say in the department. There might be 3 people in the department, there might be 10 people in the department, but as a team member, you don't get much of a say on how things are structured. With the diploma, they're aiming the diploma towards people that are running the team. So you might need to then decide on the way that the team is structured and the way your team is working with another team. So your team of mental health might be working with another team in AOD, might be working with another team in housing support or financial support, and you're the one that it's going to fall on to decide on budgets and staffing, whether your team is of three or whether you've got a team of five or six. But the diploma is aiming you just a bit above a team member to be a team leader, which is why sometimes, as I was talking about the course, sometimes there's a lot to do in a short space of time, with assessments and modules, um, and there might be could be the same amount of assessments for a module, but you just might have to do it in less time as somebody in the certificate for. And then the short course, somebody might be doing this module as maybe an intro to mental health work. It could be doing this module and it can do it in 6 weeks and then do it in a couple of months if they want. They do all of the same assessments as you, but they've got heaps longer to do all of that in. Your course equally they haven't got any deadline dates set for any of the assessments because life goes at different speeds, at different paces. Sometimes you're going to have loads of time to work through assessments, and sometimes you're going to have very little time. So if you're in a period where you haven't got time to do assessments, you might want to put them off for a few weeks and then catch up when the kids are off school or when the kids are back at school or when you can book some annual leave in to smash out a lot of assessments. So basically, there won't be a deadline for any assessments this year for you. However, if it was me studying and I kept putting assessments off and putting assessments off, then I'm going to go 9 or 10 months and then suddenly have 30 role plays to do, 20 quizzes, 10 projects, all in like a few weeks. So it's good to track through them consistently. Quite often do at least one assessment a week. That can work. But it's up to you. This is why it's adult education. You can structure your own education and do it however you want. So anyway, after all that waffle, with communities that you're working with, sometimes there's a whole community that people that need the community support, but there's a whole community that doesn't have many programs in there. There might be a serious issue that needs tackling. There might be quite a lot of issues, whether it could be housing issues, like low number of houses for people to rent, or low quality houses that are inundating the community. And even in that community of low quality housing, there's still too many renters to try and make use of that. Or there's no jobs in the area, so the people that are renting the houses are struggling to pay for the rent, and they haven't got enough money to go around with the food for the families. So there's a lot of financial aid needed in the communities, or there's AOD problems in the communities, or there's a lot of mental health problems in the communities, or there's a mixture of them all. And a certain area of the city might have so many of these issues. But then looking at the community, there might not be many resources for all of the issues that are going around. Specifically, parenting programs. Some great parenting programs, like Circle of Security. There's another couple that are really, really popular. I can't think of them off the top of my head, but they're great. And when they're not being run in a community that needs them, like from a community centre or a school, it shows the lack, unfortunately. So when there's no courses or there's no programs being run, we can see it in the lack of community involvement. Even putting one course on, maybe, or maybe one program on for parents in the community can tighten the community and make it a little bit stronger just because somebody runs a parenting program. And people can get together and come together and start to get to know each other a little bit better. So that's the type of thing that we're wanting to look at. Groups. When we're saying groups, it might not be a community, the whole suburb. It might be like a cultural group or part of a cultural group. It could be youth, the youth of one religious group, or the youth of or the aged in one cultural group. So we're looking at groups, the lack of connection with broader community. And obviously, if one group gets really, really tight, it can isolate itself away from the major community, which causes some problems. So a lot of times, specific needs require intensive resourcing. Obviously, with some problems that are happening in the community, it's if there's no resource, if there's no programs there to help, then the team leader, somebody is going to have to go looking for budget to get the program run in the community. And that's often why there's no programs there, because somebody doesn't know where to get the money. And the money is there. There's money out there to run all sorts of programs in loads of communities. So if there's something not happening in a community, it means that somebody isn't thinking about that community and getting money out of the government, because the government has the money. People can find it when they need it. Individuals with AOD, housing, mental health issues, financial issues, mixture of them all, poorly managed physical health. When there's more than one issue, I'll throw that cliche word in, the co-occurring. When there's more than one issue for somebody, they call it co-occurring or coexisting or comorbidity. And you'll hear it lots, so you'll remember them. And it means the same thing. It's just a different professionals will use the different words. You might get psychiatrists and health professionals calling it comorbidity. So if somebody's got mental health issues and alcohol or drug issues, the psychologist or a GP might call it comorbidity. Somebody who's a poly might be talking about coexisting issues. Community workers might be saying co-occurring issues. So just remember that they all mean exactly the same, but you will hear all of them at different times. So we had the issues, the risks. We're looking at communities, the lack of services, lack of community involvement, the lack of education. Not just school education, but the programs that, whether it's for parents, whether it's for men's shed, whether it's for young people, like youth groups, youth clubs, education covers all of that, because that's one way into that cultural group, that community. And even if it's a huge community, like a massive community geographically and a massive community of people, when we see a lack of services and a lack of community involvement, a lack of education, a lack of programs, you can see that the community is not healthy. It's not a healthy community. And it builds on itself, obviously. And some people just don't want to put services or programs or involve themselves in a community that's really, really unhealthy. And it's just the way it is. But that's where the money will go. The money will the money's there ready for very very low communities with low involvement. It's the communities above that that are doing fairly okay. There's not too many problems. If there's no programs there, that's where the money has to be fought for. That they're still important. They still need youth clubs. They still need parents groups. So different areas of society, the unemployment, poverty ladder, poverty trap, AOD issues. Obviously, we'll put mental health in there as well. And then individuals still unemployed, but now they're not just part of the big statistic for the government, that everybody that doesn't have a job is part of that unemployed. And whether they're working with a job agency or they're looking for their own work, or they keep doing casual work, that they are a person themselves, obviously. And then we're looking at general health and well-being factors and how we measure them. How do we measure somebody's health? How do we measure if all of these are healthy? So we can go to a GP and have a health checkup, and he'll give us a health checkup on our physical or mental health. But we can do very similar things with groups and communities, and we can measure the health of a group and a community and say, okay, well, this community or this massive group of people, it's not healthy. They're not acting healthy. They're not living healthy. The whole ethos of the way they run is just not healthy psychologically, emotionally, mentally, and things need to be done. And just like a doctor, just like when we go to the GP, they'll tell us, all right, no, you're not healthy. You need to do this and you need to do this and these things. Do these three things every week and your health will improve. We can do the same with communities and community groups. So that is linked with protective factors. Protective factors are the things that keep us strong. If we've got lots and lots of protective factors, that means that we can quite often cope with a lot of negative circumstances, even horrible circumstances, because of the protective factors that we've got. And when we work with clients, individual clients, we will be trying to help them. And the first thing we'll do is look for their strengths. Like what strengths have they got that will help keep them strong, help keep them sustained. And the things that keep people strong are the protective factors. So looking at individually first, connecting with culture is a massive thing. And it's not that one culture is better than another. It's not. But we see that when communities are unhealthy, if we can connect the people in those communities with their culture, mentally and emotionally, those individuals get healthy. And it works with young people. You can see it working with young people a lot more. So young people disconnect with culture, follow social media or media culture, which involves partying and drugs a lot of times, or living for themselves and living away from family focus. And that's not any specific culture. That's like white Aussie, that's Muslim youth, that's Christian youth, Hindu youth, Indigenous Australian. When these young people ignore their own culture, their culture of origin, and start to focus on the media culture, the party culture, the health will start to slide. And then when we can connect them back with culture, their own culture of origin, their health, their mental health, their emotional health improves. We can go into youth clubs and do that. We can go into drug and alcohol rehabs and do that. And we can do that in jails and do that. And we see it time after time. It's not a specific culture that helps somebody. It's getting that person connected with their own culture of origin. And when they feel disconnected from that, they feel disconnected from the elders in their community, the priest in the community, or the old people in the community, the old like wiser legends in the community, and the veterans from Anzac Day in the community. When there's a disconnection, then the young people's mental and emotional health is going to go down. So for individuals, for protective factors, physical health as well, trying to get somebody's physical health built up. And even physical health is split off, obviously. To be physically healthy isn't just nutrition, exercise, and sleep. To be physically healthy, you need to be emotionally healthy as well. You need to be socially healthy. You need to be culturally healthy, spiritually, maybe. So to get somebody physically healthy is more than just getting them to eat a healthy diet. It's talking about well-being, and ensuring that people know how to seek help and where to get it from. If people are pretty healthy and they're connected with culture, but they don't know where they can resource help and support when they need it, that's difficult. So we have to be out there making sure that they know where to go and how to access the help that they need. So with groups, positive relationships, safety. Safety is important. When you think about Maslow's hierarchy of needs, safety is one of the most important things. But it's not just about safety is not simply about not living in a country that's torn up by war. Safety is making sure that I'm physically safe, but do I feel emotionally safe? Do I feel emotionally safe in this relationship? Do I feel physically safe in my neighborhood? Do I feel mentally safe in my workplace? Safety is huge, and it affects every single area of our well-being. Got to be inclusive, and we've got to have strong community networks. So that's working when all of the individuals in the community are all have a strong well-being, a strong high health level, then that builds the group and it builds the community into a very, very healthy community. So yes, you can look at communities, but then look at the individual and try to make each individual strong, which is where there's been a lot of youth work study done into resilience. One protective factor is, after a lot of youth work studies, they've figured out that if a young person is resilient, then they can put up with a lot of stuff through their life. But the young person doesn't realize that being resilient is having that well-being that I've been talking about, being physically healthy, being mentally healthy, emotionally healthy, being socially healthy. And that affects quite a lot. Like socially healthy, a bit of bullying from social media will soon put a stop to that. Physically healthy, a family that's struggling to make ends meet and trying to keep everything together so that the kids can get to school and somebody can go to work, and sleep patterns and nutrition can get knocked out of whack, means that a young person's physical health is not going to be as strong and resilient. And all of this stuff that was studied on young people, it carries all through the generations. So yes, it was studied in young people, but if we're resilient and we have a strength in our resilience, it works for adults, it works for aged care, it works for any area of society. So part of our job is duty of care. when I know a lot of people, when we get into community services work, we go in because we feel like we're born with a duty of care. I'm doing this job because I don't know, I just have this, I want to care. I want to care for my community. And I feel that's where my job is going to lead me. When we talk about duty of care, it's a legal thing that is not an emotion, it's not a feeling, it's not an altruistic vocation thing. It's a legal requirement that it's the way we do our job. And it's not just that we would care for somebody beyond our ability, because duty of care has been um, legislatively described as reasonable care. So, duty of care isn't answering the telephone to a client at 7 o'clock at night because you've left your phone on you and you're worried about them. That's not a reasonable level of duty of care. Duty of care is the reasonable level when most people in that situation would do the same. So, for instance, if when when people go to court because they're getting prosecuted because they didn't show good duty of care or reasonable duty of care, then the court tries to determine what what most people in that position, in that role, in that industry would do if they were in that situation. And two examples would be if for a police officer, if a police officer's duty of care is to taser a 93, 92, 91-year-old lady with a knife, if that's normal practice, then the police officer is agreed that, yeah, okay, that's fair enough. That was duty of care. You were trying to protect everybody else. That's fine. If the court decides, no, that's not duty of care doing that, then it was unreasonable for that officer to do that. Equally, if it was reasonable for, and I don't work in care work, I don't work in aged care. So if the court decided in aged care, if it's reasonable for the care workers to call the police because a 90-something-year-old lady with a Zimmer frame has got a knife, if that's duty of care, then the court will decide, okay, no, that's a fair thing to do. If it's late at night and you need some support, so the court decides what is reasonable, and if we fall short of that, then we get breached and we get taken to court and prosecuted. But if we go over that, if we keep going over and above our duty of care all the time, we get one out, unfortunately. So it is sometimes a balancing act about protecting ourselves most of all, so that we can then give duty of care the best we possibly can. Duty of care is the worker's experience. That's the way we're meant to be working. It's meant to be following through our duty of care, and it's all about our training. If we're working in a warehouse or a factory, the court prosecutions would probably most often be around the area of maybe physical hazards in the workplace, and a forklift has damaged somebody's car, or a forklift has run over somebody, and this place isn't a safe place to work, and there's physical dangers everywhere. In the community services sector, our prosecutions at court are duty of care, privacy breaches, confidentiality breaches, clients that didn't know what they were meant to be doing with us, and now we've passed somebody's details on to somebody else, and they weren't expecting that, they weren't wanting that. So the prosecutions and the court issues that we have are all to do with client relationships. It's not physical. It's most often these intellectual property sometimes. That's somebody's details that they own. They own their individual details, but we've passed them on to somebody else without approval. So we've got to be careful with how we're trained, who we're listening to. We can value our supervisor, our line manager, our team leader. They are going to help us navigate the legal minefield at times. And qualifications, obviously, is going to be important. So duty of care for age and capacity of the person, it's going to be different for a young person to an aged care person, a senior person. It's going to be different for colleagues and visitors to the organisation. So somebody who works there and somebody who volunteers, or somebody who comes in on maybe a day program, or somebody that isn't fully there is going to have different expectations than somebody that's maybe further up the food chain in the organisation. Obviously, I've already mentioned that you get sued if you breach your duty of care, and considering what a group of peers would see as reasonable. So with duty of care, if we do get prosecuted, then that shows what they're trying to show is that we failed to follow the organization's policies and procedures. So the law says we have to have duty of care, but two different organizations are going to see duty of care in slightly different ways. In one organization, you might work 9 to 5. In another organization, you might work 6 to 12 on a shift work. In one organization, you take your mobile phone home with you, your work phone, but you turn it off after you've finished your shift. In another organization, you leave your work phone on the desk. In another organization, you turn the phone off and you leave your laptop at work, or you take it home. So every organization is going to be different, which means what one organization would be suing somebody for, another organization won't. In the end, if we break the policy and procedure of our own industry, of our agency, then we've broken industry law. And then we've obviously clearly breached the duty of care. Just wanted to skip on a little bit. The thing that all covers everything, where, like I said, the government says we have to have duty of care, but then they put in place the legislation. So yes, we've got to follow organizational policies and procedures, but when every organization might be slightly different, it's the legislation we're following in the end. So we've got to comply with industry and sector codes of practice. Potentially, we might subscribe to newsletters that are keeping us updated. We've got to quite often join industry groups that are like a Australian Community Workers Association, things like that, that are going to protect us. If anything goes wrong and we're part of an association, that's going to help a lot. And we've got to make sure that the government is wanting right across the whole community sector. We need to be better this year than we were last year. We need to be better next year than we are this year. The only way to do that is through thinking about the job that we're doing and engaging in professional development and making sure that next year my target is to know where I could do better this year and start doing that next year. Personal study and industry journals are going to help and work. So we can look at different courses that are put on, different professional development courses, in looking at newsletters, looking at journals, health journals, medical journals, are all working towards making us better at our job. when we're looking at policies and procedures, we've got codes of practice, the way we should do something. A policy is something in a workplace, and then an industry standard. The whole community services have to do it in this way, but each industry will do it slightly different. So the main one is National Practice Standards for Mental Health Workforce. Scribble that down if you haven't scribbled anything else down. That is the main legislation. For some people think that is the thing that binds us and restricts us, but that kind of protects us as well. If it's telling us how to do our job, then there's a clarity there that will protect us and keep us going. And then we've got the National Framework for Recovery Orientated Mental Health Services as well. And this is, when it's a national framework, this is the government saying, okay, this is our plan for the whole mental health service. They'll update it every few years, probably about 8 to 10 years, it'll get updated and keep getting updated. And this is their plan for, this is the way they want it to run. An example of that, and it's not been working everywhere, despite what the government wants. And part of the national framework is a no wrong door policy. So you're working in mental health area, but a client comes in and wants some alcohol and drug support. Well, you don't do drug, alcohol. Oh, if you don't do drug and alcohol support, a lot of services might say, I'm sorry, you come to the wrong place. There are certain states and territories where they would do that, despite the federal government saying no wrong door policy means that if you don't do housing support, or you don't do financial support or gambling support, that's fine. You don't need to provide that service, but you need to know who does provide that service, and you need to refer the client to a really good service that does provide that, because we don't want anybody at a closed door. We don't, whatever the client is wanting, maybe it's not the service that they were offering, but it's maybe the clientele. So we don't offer services to people that are full-time employed, because we have to make sure that we're only offering services to people that can't afford it, which means that we're going to potentially turn somebody away. But then we say, well, okay, I know somebody that does offer services for people that are full-time employed, and I can get you a referral and connect you with somebody that will work with you. So it's extra work, because we're not going to see the outcome of the positive work that this client is going to have. We might not see their recovery, but we have to forward them onto a service that will work with them. So we've got the National Practice for Mental Health 2013. This is the practice domains and the key capabilities required for the mental health workforce to operate in accordance with the recovery approach. The recovery approach is the key word that no matter what's going on, just like our professional development is going to get better and better every year, and our service provision is going to get better and better every year, the recovery approach is the expectation that no matter what client is like now, we're expecting that focusing on recovery means that their life is going to get better and better just by working with us. 3 months, they are hopefully going to be better after 3 months with us than they were when they started. And then the government looks at it, and the government looks at all the statistics, all of the data, and says, why isn't that client better after 3 months with you? And they'll narrow it down and pinpoint individual clients. Sometimes our line manager will, sometimes the industry people are going to be looking at people and saying, okay, so this person was with you for 3 months, and why weren't they better when they finished with you than they were when they started? Sometimes it's not our fault, but we do have to explain for it. We do have to give reasons why maybe there was some trauma that the client went through sometime in the 3 months. And it was amazing that they still survived through all of that 3 month trauma. But we will have to give an account for it if they're working for us, because the government is paying quite often the non-government organisations. They're getting money from the government, or they're getting money from um, industry in the community. If somebody is accessing a service and they're not better after a few months in an agency, then somebody's going to ask why. What's the money for then? If your clients aren't getting any better, then we're not going to give you the money. So we do have to figure out how to measure whether a client is improving. Looking at assessments and looking at progressive assessment through the time, we've got to figure out how that's going to work. So we've got guidance on tailoring recovery-oriented services, which means that we are looking at making sure that everything that we do is aiming them towards a recovery-focused life. Even down to if they've come in for their mental health problems, but we're drilling it down and we're getting them referred to a nutritionist or a dietitian because we think that's important. Or they're coming in for mental health and we manage to get them a GP referral for an exercise gym program because that's important. Or they get it's a mental health issue, but they end up with getting referred to like a gym for a yoga instructor or something like that. It's all about recovery in the whole well-being. So the National Framework for Recovery-Oriented Mental Health Services says that we complement the discipline-specific practice standards or competencies of a different professional groups, so that everything goes hand in hand. Each discipline, each different area, different focus, all of the competencies, the measurements that we put in place, they're all pretty equivalent and they've all got to be leveled out with all the different groups. We've got to share the knowledge, we've got to share the skills required when working in an interdisciplinary mental health environment. So it's about the shared skills and the shared knowledge. And when I'm saying shared skills and knowledge, that's agencies working together. Agencies that don't necessarily agree because they've got different ways of doing things, but they can still work together for the well-being of a client, or for the well-being of a cultural group, or the well-being of a community. We've got work health and safety. So we haven't just got mental health legislation that is structuring the way we work. Obviously, if we're going to work, then work health and safety is going to structure what we do as well. Even if we working in healthcare, even if we're working in mental health services, we still want to go and work in a safe environment. That is, I'm sure some nurses or some paramedics would say it's a bit of a joke to think that we can expect to go and work in a safe environment, which is a shame. But whether we're an NDIS care worker or we're working in an AMBO or a paramedic, we have a right to work in a safe environment. That also means that we need appropriate insurances. The association, the Community Workers Association that we might be part of, obviously they're going to protect us, but we will need liability cover in some way. Maybe the agency that we work for has already got that, or maybe the agency is going to expect us to have our own. Quite often, if we're like a private care worker and like a sole worker, we might have to have our own insurance to cover us going into other people's homes. We still need to be trained in WHS and opportunities for further training as well. So, like first aid, obviously, this course requires you to get a first aid certificate. Just because you might be working with people, it's going to help. And then reporting incidents. How do you report a work health and safety incident? There's a pretty standard way that most people will work with, but then sometimes there might be a slightly different way that it is expected to be done in different agencies. I just wanted to leave it there before break because I just wanted to get a few other things done. First of all, it's just a few like announcement type things and things that can help. First of all, this is, put it back on the screen. When we're looking at each module, HADA didn't design the modules. The government has designed all of the modules. So people in the government, people have worked together with community services sector. They design the modules together. So your diploma has been designed by the government. And they've said this module is about it's about getting the skills and knowledge required to develop and conduct early intervention, health prevention, and promotion programs focusing on mental health and well-being. All of them are important words. Knowledge means that you can answer questions on it. You'll do a research project, probably. You'll do some sort of quizzes, written questions. So you have to have the knowledge about the legislation, about the right way to work. Skills is how you respond to different people in the workplace, like how you listen to somebody, how you talk to people, how you talk to a client. This is all skills that you'll put into practice in a placement, but also in the role plays. Role plays are really, really important to build your skills so that you can get a placement that is going to do you justice. So skills and knowledge, but then to develop is not just get something. Develop is that you're going to develop it, that you're going to grow and you're going to build on it. Early intervention, whether that's early intervention mental health issues, early intervention mental health could be with youth, or it could be at the first stages of somebody's mental health issues, trying to catch somebody before it gets really bad. Health promotion could be working with all sorts of community centres and trying to promote healthy living, whether that's exercise, sleep, nutrition, health promotion programs, focusing on mental health and well-being. And then again, well-being is more than just being physically healthy. It's all of our whole person being healthy and strong. Also, Discord. Discord originally was, well, still is used by gamers, the gaming community. And we have got it to help people with assessments, role plays, so that you can get on this mental health today. So you can get on this, talk to other learners, and get some support with your assessments immediately, rather than didn't expect to see people that are in the room. So that if you needed some support with any of the questions or connecting with a role play, there's so many role plays that are really, really complicated to set up when you first start. Jumping into here can help. There's staff in here, there's learning support in here. So it's a good idea to, first of all, get yourself an account with your email address. So set up your own account first. And then once you've done that, then you'll be able to accept the header invite, which is it's in Accelerate. And if you type this Discord, if you type Discord into the Accelerate search, it'll show you how to accept the invite. So you accept the invite, and then you read the terms and conditions. Like my head's gone blank. Not sharing answers, like don't share answers on there. No profanity, respect each other, things like that. And like I said, there's stuff in there. Once you agree to them, then you click on one of the accept things that you accept all the terms and conditions. Then it will take you into all of these different areas. So there's a channel for all of our different streams in HADA, youth work, community services, alcohol and drugs, mental health. Then role play resources. If you haven't looked at these yet, they're really, really good. Some people might think that we're trying to give people assessments just to see how we can get people to fail. And it's not like that. The government has set an expectation of how you're meant to pass this course, and we want everybody to pass the course. So we're doing role plays, trying to give advice, whatever we can do to make sure that you pass the course, we'll try and do it. So there's little videos on how to do role plays really, really well. What the government is expecting when it expects you to do a role play of talking to a client about domestic violence or suicide. How do you do that? There'll be role plays. If you can't find somebody to do a role play with, then this is what this website is for. Basically jumping in and saying, is anybody free on, I don't know, whenever you're free, Saturday morning, just to do a role play for half an hour. If the mental health, if you can't find anybody in this stream, there'll be plenty of others. You're free to go into the others and say, does anybody want to be a client for me in the role play that I've got to do? The thing is that all of these courses, 70% of it, everybody does the same modules. So while the one we're doing tonight is a mental health specific one, not everybody does that. Most of the rest of them, 70% of your modules are done by the youth workers, the community services workers, the AOD workers, which means somebody else could give you advice on how to do the role play that you're looking at, and they might have done youth work, and you need to know how to do an assessment. They would probably still be able to answer the question for you. So that's that one. And if you ever need anything, any help with anything, then this is how to get in contact with me. This is my calendar link, so I'll copy that into chat for you. Usually Mondays are easy to get into. You just click on that calendar link that I've put in the chat, and it tells you what's free at the moment. If everything's booked up, then contact LSO, and they'll still be able to get through to me, and we can figure something else out elsewhere during the week. Mornings are usually great. our survey. I was wanting to look at the assessments as well, but I think I'll do that after break. We've got a survey going on um, for our courses. So I'll give you a link to answer it when you've got a minute. I'll put that in the chat as well. That'll be easy. This is SurveyMonkey. It's I'll click on it because you might have to do something very, very equivalent. Um, any in any community service, as I said, people who are paying for your service are going to want to know how successful you are and how you are providing a good service or a bad service. How are you good value for money? Is your service good value for money? And are you good value for money in your service? So the best thing to do is set up a questionnaire and ask the clients, how good are we? It's one of the easiest things that you can do to then pass on to the people with the money and say, our clients are saying this. So just when you got a minute, just answer the 8 questions. So this is the free version. Um, when if you pay for it, you can have a lot more questions and a lot different question styles. But this very easy to use, very easy to create questions, and it's free. Just to I'm sure you'll be using it one day soon. And I think that's it. Let me just check. Yes. So actually, this last thing, this is a learner guide. Every module has a different learner guide. So this is the learner guide for this module that is 2 weeks long. So this week and next week, provide early intervention, help prevention, and promotion programs. This is what we've got to study, 2 weeks. So there'll be maybe this week, maybe next week. And there's questions in here to guide your learning. These aren't your assessments. Your assessments aren't in here. So you can answer questions in here just for whenever it asks you certain things. All of the activities in here, they're only going to help you. They're not here to add extra workload. So if you don't get time to do them, that's fine. The assessments are what we'll look at after break time. Sorry, I'll just check what somebody's saying. Yes, if you need the learning guide, I can give you it now. Is Accelerate open for this module? Can anybody tell me? Did Brooke just shake her head? Oh, Brooke nodded her head. Okay, good. Sometimes it might not be open. So in Accelerate, if you go down the bottom to resources, then you can quite often easily find it there. I've heard, because I can't see what you can see in Accelerate. If you go to the search bar and type in the module code, this CHCMHS009, you can apparently find the learning guide like that. If not, then I have it obviously, so I can give you it, and I'll put it in over break because I have to download it and then upload it into the chat box. And yes, the learning guide is important because if you don't understand what on earth I'm on about, or you miss one of the weeks, then you can carry along with the learning guide and it'll fill in all the gaps. So yeah, leave it there for break and we'll come back in 10 minutes. So just want to get onto the assessments now. So like I said, don't stress out because of if you don't like what you see, because you've got plenty of time to do. Um, so we've got quiz, just a general. I've put the learning guide, which is really useful for the quiz. I've put that in the chat already, so you can download that if you haven't got it. Basically, the quiz goes like complete following table. All the details, the facts for this are going to be near the beginning for question one. The last question for this, it's question 11. They'll be near the end of the learning guide, which means some of these questions you won't necessarily understand because we haven't done week 2 yet. But sometimes, or quite often, it's common sense and it's pretty straightforward. Sometimes there's 23 questions. This is only 11 questions. You could sit and get this ticked off pretty easily. There's only 3 assessments there for this module. So that won't take long. Task 2 is like a research report. They usually, there it says, 1,000 to 1,500 words. In old language, 1,000 words was 4 sides of A4 paper, which was almost like a high school project. That might be triggering for some people because we all hated high school anyway, but that's not the point. 4 sides of A4 was a standard HSC type thing. And by the time you've split it up and structured it all, they're not difficult, especially when when you're researching what you're wanting to do, that's pretty straightforward. So your assessment task for this unit competency will include identifying, researching, preparing and implementing an early intervention health prevention program or health promotion program which focuses on addressing a mental health and well-being issue. So what initiatives have you heard of that are working really, really well in mental health work or community work? Or maybe you've seen some that don't work and you want to find one that really does work. Figure it out, research it, and just tell us all about it. Gather the information, conduct the research to identify a need within the community or group that you're interested working with, prepare a report which goes down there like that. We're not going to look over this in detail yet. We'll do a bit more looking at this next week because I want to get back to the questions later. And the final assessment is, what's this one? It's not a role play. Is this a project, which is different to a research report? Okay, so it's like, it's not a straight off 1,500 word research report. It's lots and lots of different things working together to build up all of your knowledge. It keeps saying program plan. So I guess that's what it's trying to talk about, a program plan. Thankfully, there's no role play for this one. So that's good, which means we've got plenty more time to do other stuff. We've got more time actually to do role plays from other modules. So if you need to if you've been here longer than a week or a few, then if you still have role plays waiting to be done, get them ready for next week. We'll have heaps of time for them. Well, back to the questions anyway. So we've got 12 people. Well, that's me, 11 people. So we'll divide these up. I'll split you into groups, put you into breakout rooms so that you can work together as a small group and give you a few questions each. Then you find the answers for the couple of questions that you've got, and then we bring them all back together and see what everybody's found. Let's do the rooms first. Let's do 3 rooms. Okay, so 3 rooms, that's 4 questions each, really. For 3 questions each. 4 is too many. So for the first one, the first group will be Brooke, Juliet, and Kiri. So Brooke, Juliet, and Kiri will do 1, 2, and 3. That's easy. So let's not do all of this. Let's just do any of the issues or the risks or the protective factors. And the question is complete the following table by listing at least 3 mental health and well-being issues, risks and protective factors that can impact communities, groups, and individuals. So yeah, just do one, because if you've got 3 questions to do, then it's going to be a lot. So that's question 1. Question 2 is Hannah has recently been employed by a local government in New South Wales to arrange a series of community promotions focusing on rural community mental health and well-being. She's recently moved into the area from Western Australia, so decides to begin by assessing and reviewing the population health, demographic, social, and epidemiology trends of the communities that she will be working with. Explain how this information will be useful to Hannah in planning the promotions. So that when it says explain, it's wanting reasons. So like here we've got list. When it says list, it's literally just wanting separate sentences. There's no real detail in there. When it's and we've got list there as well. When it says identify, it's wanting a few sentences to there's identify again, a few sentences to give a description. So you've got to pick something out to identify it. Describe is the next thing up from identify. Describe is going to probably want a paragraph or a few. And then explain, which is this one. Explain is at least 3, maybe 4 even, reasons why. So it's saying explain how this information will be useful in Hannah in planning the promotions. Well, you could even pick out and just structure it like health, demographics, social, and epidemiology. So there's 4 different things that she is wanting to look at. So if you give me a reason why each of them is going to be important, that will almost cover it. And then you put it together and you make it sound good. You're almost there with that one. So describe the duty of care to clients living with mental health issues, their families and extended care networks, the community members and groups who you work with, and your colleagues and the other people in your workplace. Straightforward. Everybody's going to have a different answer, so everybody can hear the examples that the people are using. So group 2, we've got Alison, Caroline, Joanne, and Therese. Are they all here? Like some people are. Some people are not. I don't know whether they're here or not because they're not on camera. So has the computer crashed and stalled and it disappeared? Hi, Kiri. Yes, Kiri, you've got your hand up. What is the everything all right?
No, it's Kim. I'm Kim. Not Kiri.
Oh, fuck. I'm sorry, my eyes are like they're getting so bad.
What are we doing exactly here now? Do you want us to answer questions now?
Yes, you're going to answer these first three ones, the
But where do
first
we
three
get the
questions,
information from?
the learner guide and the wonderful internet.
Okay.
The learner guide will be the safest, quickest, shortest answer ones. That'll start you off with with question two. You'll need to be branching out and looking across the internet for that because it's wanting a lot more information. But yeah, you just do them three questions, and then when we come back in about 20 minutes, then everybody will feed back their own questions, and you can get an idea of what everybody's been writing down. Sharing answers is fine. You might not like what other people are writing down, so you don't have to copy their answers. So it's fine. Um, so you're researching that.
I've lost where the information guide is.
That's I can put it in again. I can
Yeah.
put it in the chat again, just in case. Um, so if anybody can see underneath the video, it says chat. If you click on chat, it'll bring up the chat box next to the video screen, and then this is where this is going to get put, just next to the video screen. Group two is Alison, Caroline, Joanne, and Therese. I've already said that. I'm getting deja vu. So that's going to be question four. List the specific mental health legislation which applies to your work in the mental health sector. How does the legislation impact your practice? What strategies do you have in place to ensure that you stay up to date with changes in legislation? So obviously things like professional development and training courses and things like that. That's the type of thing it's trying to get at. Five, if you can't get into Accelerate or you don't know where these assessments are, you might need to screenshot it or take a photo with your phone. And if you need me to go back to any questions, we can do that. So five, in question two, Hannah had just begun to research the communities that you would like to be working with to develop a series of community forums. She's identified a range of issues that she's decided to develop a library of credible resources of information that she can draw on when developing each program plan. List at least three credible resources for each of the areas below and describe the criteria that you've used to assess the resources that are credible and reliable. So that's about where do you go for credible resources on the internet? How do you know if something's like useful information? How do you know if a website is completely worthless and you shouldn't even be looking at it because it's just whatever they say, you can't trust it. With these areas. And I'm sure you've got some ideas for some of them. And let's do three. So only when it's one incredible source 1, 2, and 3 for each area there. Just do three of them. I mean three of these. So pick any three of these, and it's wanting three resources for each one. And number 6, list the codes of practice, policy frameworks, and practice standards which impact your work in the community services sector. So we've been over that a little bit, which means as soon as you look at the learning guide, you'll see the same things for what you're looking for. Right, yeah, so that's 4, 5, and 6 for you four. Alison, Caroline, Joanne, and Therese. 4, 5, and 6. 7, 8, and 9 is Eileen, Kim, and Priyanka. Actually, do 10 as well. But we'll have a look. There's usually a massive question right at the end, so we might not do 10. 7, describe the strategies you use to ensure that you're applying these frameworks and staying up to date with any changes. It's fine, pretty straightforward. 8, identify at least 5 sources of information you could access about population, health trends, epidemiology, and social demographic trends. Things like the National Bureau of Australian Bureau of Statistics. If you're a bit of a geek like me, you can look at the ABS website for hours, just finding random pieces of information. So it's places like that. Where would you go to? And 9, research the internet and document at least 6 programs that relate to early intervention. Let's just do half again, just 3 programs. Health prevention and promotion. You must ensure that you have located programs that are seminars and promotional events and community visits. Provide a description of each. So when you've got biggish questions for tonight, for now, just get a bit of information for each one. As long as you've got some of each question answered. It doesn't matter that you might not have finished it, just get something for everyone. 10. Okay, 10's all right. Identify the health and safety legislation in your state or territory. In your answer, explain the roles and responsibilities of workers and employers when it comes to work health and safety. That's pretty straightforward. For any industry. That's fine. So it'll be standard for a job that you've done before. It'll be a job like work health and safety hasn't changed drastically in that long. I'm going to leave out 11. Just a bit big. When I open the breakout rooms, it'll flash something on your screen and say, click here to join the breakout room. And then it's 7:35 here in New South Wales. So let's work on this till 10 to maybe. I don't think you'll need much longer than that. So yeah, we'll try 10 to. If you do need longer, then we'll just extend the time. And then afterwards, whoever your spokesperson is from your 3, then you can come back and give all your amazing answers to everybody, and they'll give theirs to you as well. Any questions? Anybody not know where they're going to look or any problems? No, all good then. I'll be in and out of the rooms as well, just in case you need anything. There you go. All right, we'll gradually move into getting the answers for all these questions. So I'll just bring up those questions onto the screen. Here we go. So it was Brooke, Juliet, and is it Kiri or Kim? Oh, Kiri Gerard. So Brooke, Juliet, and Kiri. Question one. Which one did you do? Did you do issues? Did you do risks or protective factors? And what did you get? What was your answers?
Did you want us to just do, we were just doing one of each for the boxes?
Yeah, definitely.
Okay,
That sounds good.
cool. So for issues,
Yeah.
with communities, I had lack of mental health services.
Okay. Yeah.
And
Right.
then,
I'm not marking these just in case everybody needs to know. You're just putting answers in. Everybody's putting answers in, and they'll get marked when you hand the assessment in. Carry on, Brooke. Sorry.
no, for groups with issues, I wrote discrimination or marginalization.
Okay. Mhm.
And individuals, I wrote depression or anxiety.
Yeah.
For risks, I did poverty and inequality for communities.
Yeah.
For groups, for risks, I wrote group stigma or negative labeling.
Yeah.
And then individuals, I wrote low self-esteem.
Cool.
And then protective factors, we were a bit, we struggled on this one because we weren't 100% sure, but I got some down. I wrote access to mental health services
Yeah.
for communities.
Mhm.
And then groups, I wrote positive group identity and support.
Mhm.
And then for individuals, I wrote strong family and social support.
Oh, great. Yeah, that sounds good. Um, okay. Number two, Hannah's recently. I'm not going to read it again. I've already read it once. Um, you know what it is. What did you get for this? Explain how this information will be useful to Hannah in planning the promotions.
We kind of brainstormed this one
Cool.
a bit because it was kind of, there was a lot to do with it. I did start writing up a little bit, but I didn't finish.
Is it here, Camilla?
So we did, so I wrote a little bit, if I'll read it out.
Okay.
It says, this information will be useful to Hannah's planning the promotions by assessing and reviewing the population health, helps Hannah determine arising health issues that may need more attention and research, and to gain a better understanding of the mental health and well-being of the overall population in the rural community. Helping her identify arising issues using demographic research, Hannah can determine age groups, and that's all I got. Sorry.
Okay. No, that's a good. Yeah, that's highlighting it pretty well. It's a good start. And describe your duty of care to clients living with mental health issues, the families and extended networks, your community members and groups who you work with, and your colleagues and other people in your workplace. It's a big question.
Mhm. So for this one, um, we just got it off the learner guide. Um, but so the learner guide, I just copied and pasted it, but it says duty of care is a legal requirement in all professional settings, whereas a service is being provided. As a support worker, it includes providing care to a certain standard, upholding the rights of your client, and carrying out considered actions that minimize and prevent the risk of harm occurring to your client. And then duty of care can also apply to engaging with your colleagues, families, and children of your client and the visitors of your workplace.
All right. Yeah, that sounds good. Let's go on to number four. That's the next group. That was Joanne and Therese. A couple of people left, one from each, or a couple of people from one group have left.
Okay. On the mental health, the first section there, I'm in New South Wales, so I've got the Mental Health Act 2007 in New South Wales,
Yeah.
Mental Health and Cognitive Impairment Forensic Provisions Act 2020, New South Wales, Children and Young Persons Act, also the New South Wales one, the Guardianship Act. I don't know. There's so many. How do I know which of them are the relevant ones? Or do I just list everything I can find?
You can list a lot of it, but really when there's so much, you're just picking three, really.
Okay.
So like you don't need everything, but just narrow down whichever one takes your fancy.
Okay, cool. Because there's like, then it goes on to disability inclusion and all those acts as
Yeah.
well. It goes really far. What I've got, how does it impact your practice? I've got that legislation is there to protect the worker and the client's right? So all procedures and policies must align with the legislation. And then also legislation may differ between states and territories.
Okay, yeah.
Yeah. So do I need to build out on that workers and clients' rights? That's what, because that's the impact that it has. Your policies and procedures are going to, or do I need to say more?
No. That should be fine. How does the legislation impact your practice? Let me have a look at what it's expecting. I'll come back to it in a few minutes.
Okay,
That'll
cool.
be easier. And what strategies?
There's actually more. Okay, but just, yeah, the professional, joining professional organizations, attending professional events like conferences and seminars, signing up to mailing lists, joining social media groups, joining online forums, keeping up to date with company policies and procedures, and reading research. I think that's supposed to be research reports, and participate in ongoing training.
Yeah, plenty of them. So number 5. This was just any three, wasn't it? Any of these three, and then 3 examples for each.
Well, the which one is it? Mental health.
Okay.
So for exercise, fitness, exercise, and physical activity. For mental health, you could join a gym, you could do a walking group, whatever took your fancy in that side of the role.
Yep.
Credible resources they'd come from like either word of mouth, from websites, from pamphlets. Even your GP can refer you to them.
Yeah, that's true.
Yeah. And being in the mental health, if it's in the mental health sector, they can actually refer you on to services that have all that included in it.
Yeah. Another one. Which other one did you pick?
Sexual and reproductive health.
Okay, cool.
So the sexual and reproductive health, the credible resources would be your GP for starters, like an IVF clinic type thing if it's a reproductive thing. What was the other one? It was sexual diseases to see whether you have any or not. So there's a special group out there that just deals in that type of thing. But I can't remember the name now, because if I click out of this, I click out of everything. So yeah.
Sorry.
No, it's all right. And the other one I did was nutrition.
Okay, yeah, great.
So with the nutrition side of thing, you'd have a dietary a diet plan.
Okay.
You would have like a speech pathologist, if that's what it is, because they can actually determine what type of fluids, foods, and everything you should be on.
Right. Okay.
So, like, if you're finding it hard to swallow, they can tell you that, right, well, you can't eat a normal meal. You'll have to downsize it to a bite size, soft chewable meats and everything like that.
Right.
And your GP can refer you onto that. You can find them through health food stores, word of mouth with nutrition, with nutritionists.
Okay,
As you
yeah.
see, all these fad things that they've got out, light and easy and things like that. So, yeah.
Yeah. Let's jump on to number 6 then.
Well,
List the code of practice, yeah.
this varies from state to state, the list of codes of practice, because I'd go under the mental health sector, the Mental Health Act of 2022 for Victoria.
Yeah.
So, and then you've got the community service one in Victoria as well, whereas other states will, New South Wales, Queensland, South Australia could be all under different legislations. So, yeah, I just put in Victorian ones.
So you don't forget that you don't need to know all the states and territories legislation on anything. You just need to
I
know.
know, but that's what I was just putting a point across to state that, you'll have assignments that will come in that'll have Victoria, New South Wales, New Zealand, things like that.
Yeah. When, for everybody else, that when any legislation changes, or any legislation that we're looking at, whether it's child protection or any drug and alcohol things, if you don't live in New South Wales, you don't need to know New South Wales. If you don't live in Northern Territory, you don't need to know anything about it. Even you don't need to know how it's different from yours, really, wherever you're living. But just make sure that you know exactly what needs to happen in your state or territory. So you
There's
have to
not
know.
much difference between states and territories with the legislations and policies and whatnot. It may be
That's
just
fine.
worded different or something really simple, actually.
Okay. Just before we move on to the next one, Aileen, what were you going to say?
Yeah, I just want to ask some clarification. If I do my what they call this internship, equivalent to work,
like a placement,
placement here in Queensland, and if I move to New South Wales, do I need to do another internship or no?
No.
Okay.
It'll the placement will cover you, and because we're going PAIDA assesses the placement, so then you can move anywhere in Australia, and your placement will be credible for wherever you go to.
Okay. Thank you.
So yeah, that's good. Joanne, what were you going to say?
Hi. Sorry, I just wanted to check with question 5. I think I misunderstood the question with credible source of information, in that I put only websites where you can get stuff. Instead of saying like Therese said, you can get information from the GP, for instance. So is it asking for a GP, a nutritionalist pamphlet website, or is it asking for specific websites where you would go to find, for instance, nutrition facts and that type of thing?
A broad range. So website, yes, but also a GP.
Okay.
definitely GP, as opposed to health advice from next door neighbours and things like that.
Okay, cool. Thank you.
Oh, good. So we've got to 7 next. Question 7. 3, 4, 5, 6, and that was Aileen and Kim, wasn't it? Is that right? And we'll just do 7, 8, and 9.
Yeah, I think it was just 7, 8, and 9.
Cool. So 7, describe the strategies you use to ensure that you are applying these frameworks and staying up to date with any changes.
Sorry, who's answering?
I did 8, so I don't have
okay.
7.
Yeah, I can answer 7 in that case. Wait.
Cool.
Give me a moment. Sorry. Because we started at 8, but actually I have an answer for 7. Okay, the question will be describe the strategies you use to ensure that you are applying these frameworks and staying up to date with any changes. My answer is to ensure consistency in frameworks application and staying updated. It is important to have regular trainings, ongoing monitoring, feedback mechanism, and proactive knowledge sharing while leveraging regulatory intelligence tools and staying open to continuous improvements. Yeah.
Yeah. That's that's a good few different points there.
Yeah.
8. Kim, you said you've got 8.
8 was me. Identify 5 sources.
Yes.
Australian Centre of Monitoring Population Health, health data, social determinants of health, Australia's health data landscape, and finding good health information online.
Okay, great. Number 9, 6 programs that relate to early intervention and health prevention promotion. Was it 6 or was it just 3? Did I just say 3?
Just 3.
Yeah.
I can add more if needed.
Yep. Okay.
Okay. I can add World Health Organization provides global health data and information, including social determinants and health. National Library of Medicines provide access to a wide range of biomedical literature, including health statistics and research papers. And then Australian Government Department of Health and Aged Care. This department provides information and resources related to Australian health system, including national strategies and policies for another 3.
Nice. If we were doing 10 and 11, so, 10 was just a normal, like, work health and safety question. Anybody in any industry could answer this, or has the capacity to. With 11, it looks a bit complicated, but it's not. It's just it's not wanting a lot of detail for any of them. So you're just building up the importance of what each component means. So it's pretty straightforward, really. You just build on each one. Now, we were going to go back to 4, and what 4 means. So 4 is asking for National Practice Standards for the Mental Health Workforce 2013 needs to be mentioned. These are the standards put in place to develop and strengthen workforce capabilities. Then continuous improvement ensures that the workplace allows for and supports skills and development and allows for legislation changes that are understood and applied. Then strategies. The Mental Health Act supports people experiencing mental illness to make and participate in treatment decisions and have the views and preferences considered and respected. So that's how it builds up that answer. Any other questions about any? We'll look at the other two projects next week, this one and this one, and see what we can build with them. And obviously, if you've got any role plays, don't forget, we can do any of the role plays for the past few modules. We could get them booked, like easily, smoothly booked in next week. But if there's no questions, then we can go and get some dinner, I think. Yes, Caroline.
Hi, Joan. I just wanted to ask about one of the, it should be one or two role plays, the
Yes.
assessor led. Are we going to do it as a class, or we need to do it individual?
Excuse me, needs to be done individually, but it can be done in class here, like next week or even the week after. It's not too late. The longer you leave it, it's going to be more difficult to put it together because trying to remember what it was about.
Yeah.
And we can do it probably like 8 o'clock-ish, 8:30 next, on any of the weeks in the future, and just get them done then. Or we can book them in like with a learning support class at another time.
It's okay.
Yeah.
Oh,
so
cool.
we could get them in. Hi, Kim. Yes.
Yeah, this is my first week here tonight.
Hope you're good.
The role plays. How do you know when you're meant to do the role plays? Like, is it too soon for me to do?
It's not. You haven't. If this is your first module, then it's not going to ask for anything yet. You could easily have a bit of fun and see if anybody else wants to do one, and you could offer to be somebody's client. Just because you won't get assessed with that. They're the only. They get assessed for their role play, and you can just have fun.
Now, how do we locate them on the portal?
So you would. What's the next module? The next one is 8. Let me have a quick look at the next module and see what the next role play will be. And you can take a screenshot of it. It's quite complicated to get it opened from learning support to open the module, but you'll have a vague idea of it once I find it. Just make sure I'm getting the right one. Can't find the topic. Right. So the next topic is CHCMHS 10. So we're doing 9 at the moment. 019. No, not 019. 009. And the next one is 10. So for 10, it's going to be.
Why are we putting that at the back?
Oh, wow. So there isn't a role play for the next one. I'll keep looking further ahead. We're nearly into June now. MHS 13. This is a bit. This is really cruisy. Up again, 13. So 13 is written questions and a project. Wow. So I'll look even further ahead.
That's okay. Don't worry for now. I'm sure I'll find out
we're
as I
into
go.
June and July. Yeah, I reckon relax in doing the questions and the case studies.
Yeah.
And I'm sure there'll be other people that have been in the class for a few months that'll be doing role plays in here that might need a client that you can help
Okay.
them out with.
Okay.
All right. Have a good week, everybody.
Now, Dwight.
See you.
Yes.
Good night.
Were you going to say something, Therese?
Yep.
Yeah.
Like I've only been in here for a month, so these role plays, do I have to do them now?
Eventually. Like I said earlier, they will always be there for the next few months. Probably because we don't have any role plays at all, like for assessments until probably July. It's probably a good idea to get them done and just start jumping in on them. Can you remember any over the past few weeks? I can't think, like last week or the week before.
Last week they were talking about what to do for the role play, but
yes. So that is that was the it was a 3-part one. And so there was one part where you do a role play with one client. It was meant to be with me, but it's not with me anymore. So we scrapped that. So you just have to do a normal role play with a normal client. Let me try and find it. Then you can screenshot it. And then the other two, as far as I know, it was just a debrief with me. Just instead of a role play, it's just like a meeting of, okay, so what would you say to this client then if they were struggling with anxiety in the middle of the session? What type of things would you say to them? That's the type of thing it's after.
So, if they were suffering from anxiety and you could tell because they're jittery and breathing really fast, you'd ask them to put their head between their knees and take some deep breaths. Or if you've got a brown paper bag, give them a brown paper bag so that they can breathe into that. Slow their breathing down.
Slowing the breathing is good.
And
sorry, I've just found it. So the role play. This is, I guess, because it was the last one, this is the one that everybody's going to be wanting to focus on. I'll share the screen. So if you remember, we had a video here that you had to watch, and we've got rid of that. So that's heaps better. You don't have to watch that horrible video anymore. So your Lee or Joy, which one was which? So Joy is the client.
Yeah.
You are Lee, and you have to figure out these. I can't highlight it because it won't highlight in this box. So work collaboratively with a client living with existing mental health and AOD issues. Identify and access suitable support resources. So basically, the role play is going to go where you discuss how you're going to help Joy. Then you work and figure out what possible referrals, and it would be thinking about where you are based. So if you are metropolitan area, then you might refer somebody to some of the big agencies that you can see everywhere. If you're in a rural area, you've got to consider that and maybe think about, okay, well, if you're near me, then There's nothing around me, so I would have to refer somebody online because I don't want to send somebody with struggling with mental health issues all the way to the city when I'm 50 k's away. So it's going to have to be better online or a telephone service. Develop a plan. What is the care going to look like? Is it going to be something different every week, or are you going to be building on goals and strategies each week as it goes? That's communicate with clients is pretty straightforward. That's what you've been doing the whole that time. Manage risk is when we've got depression mentioned and alcohol makes her feel better, we're starting to talk about possible mental health and suicide issues. So we've got to consider that. So making somebody safe, managing risk, that's the risks that we're talking about. And then in the end, manage the workplace skills you applied while caring for this client. Workplace skills are the type of talking to somebody like the active listening, summarizing, paraphrasing, like counseling verbal skills. So, okay, I hear what you're saying. That must have been really difficult dealing with that. That's a lot to deal with in 1 week, or that's a lot to deal with for somebody struggling on their own. So, like empathy, all of the key skills. And when that works up to be, it's usually 10 minutes. It's never usually 15 minutes.
Yeah, well, we were talking to them last week and she was saying between 10 and 15. If it says between 10 and 15, no lower than 10 and no more than 15.
Yes, that's right. I wasn't here last week.
No.
That's right. Yes. Okay, and then you've got Sujin, which is, that looks like they've changed it from a debrief into a normal role play. So it's looking like 3 normal role plays. It's the same expectations, like this blue box, exactly the same for all 3.
Yeah.
This says it's assessor-led, but I heard we're not doing that, and it's just 3 normal role plays.
So when you do your role plays, this is what I'm getting at. When you do your role plays, do you bring the person who's going to be doing all this in with you?
You can, most people do it online because most people can't get put somebody in the room with them. So you would have just like we've got here on Zoom, somebody else. You've got to, however you do it, the same rule applies. If you've got the client in the room with you or they're online on Zoom, they've both got to be in the picture at the same time.
Yes.
And there's a way, it's up there. There's a view icon at the top of the screen, and you click on view, and you have to put it in gallery mode, and that brings everybody that's in the room, even if you've got 50 people in the room. There's never a role play for 50 people, but it puts everybody on the screen at the same time so that we can see 2 people talking to each other and interacting. And that's the same if you've got somebody in your house, like partner or parent or child is going to play your client, they've got to be on screen. And that's a problem for some people because I don't want to go on screen on the recording, but we need somebody on screen with you. They don't have to be very good actors. They don't have to act at all, really, but they have to be on screen.
Yeah.
And that's pretty much it.
So if Lee's a guy, do you have to dress like you're a guy?
No, we don't take it that far. Good question. And vice versa. No. You've got to be dressed for work, though. That's a point. That's a good point. Some people, like, they'll be not poking fun at anybody that is laid on their bed at the moment, or in a doona or anything. You've got to be maybe dressed for work and sat at a table. maybe some paperwork on the table just to pretend you're in an office.
Yeah.
No PJs and no swimsuits, no boardies.
Oh, why
all
not?
it makes look when people do dress like that, it makes the
I
role
know.
play a bit strange.
It does.
Yeah.
Yes.
Yeah. So all good.
Yeah. So how many of them can you do? Like, say I said, right, I want to get mine over and done with. I want to do it next week. So there's 4 of them, isn't there?
There's 3 here.
Yeah.
And because these are normal role plays, we wouldn't necessarily have much time in class to do these. And that's normally, we wouldn't normally do like these kind of role plays in class, but you've literally got no role plays for like 6 weeks. So I'm going to bring them in. I'm going to like have them done in class, some of these.
Yeah.
Some people might not want to do them in class, and they might prefer to do them in the daytime, but you can do these anytime. Like if this module is open for you, you can do it during the day with your partner, or um, get it booked in to do it on a Saturday morning with a friend or somebody like that.
Yeah.
Yes, Kim.
Can you upload it onto the computer? Like, can you do a video on your phone and upload it to the computer?
Yeah, you can. Like, I know people would they'll sit in a room and they'll have 2 people, and they've got their phone in the corner recording, and that works perfectly well.
Okay.
Yeah, all works.